Welcome to the Preventing Distressing Behaviors in People with Dementia training for first responders, presented by Idaho Commission on Aging and Idaho's Community Care Program. Positive Physical Approach, Module 4. As care partners, our biggest challenge is to physically interact with people living with dementia in a way that meets their needs but does not trigger a stress response. There are also cases where a person may exhibit dementia-like symptoms but be suffering from other cognitive or physical disabilities. Our job is not to diagnose the patient, but to approach them with best practices to help minimize distress. These techniques may be helpful working with a patient regardless of their cognitive diagnosis, but are specifically tailored to patients with dementia. Many dementia experts recommend using the positive physical approach. The positive physical approach uses exaggerated friendliness to signal we are not a threat, but a friend. Let's walk through the approach step by step. First, announce on approach. Knock on a door or table to get attention and signal your approach. Pause and stop around 6 feet, moving at the boundary between public and personal space. Acknowledge a person's ownership of personal space and give permission to enter or approach. Approach the person from the front. Come in with 45 degrees of center. Move slowly, 1 step per second. Stand tall before you crouch in or lean towards the person. Gesture and greet. Bring a flat, open palm near your face. Look friendly by smiling and making eye contact. Wait for acknowledgement. Make sure you have a connection before you start your message. Call the person by a preferred name or say hi. Avoid terms of endearment and offer your hand to shake. Move toward the right side of the person and offer your hand. Give the person time to look at your hand and reach for it. Make sure they notice your hand is out to shake, but offer, don't force. Get to eye level and deliver your message. Sitting, squatting, or kneeling if the person is seated. If he or she is standing, give your name and greeting. Deliver your message, simple, short, and friendly. Please note, never try to communicate prior to establishing emotional safety, comfort, and a friendly connection. This may seem like a lot of work or something you're too busy to do, but you can be confident it will pay off in the short term as well as the long term. When people with dementia consistently feel safe and secure, they are happier, and so is everyone involved in their care. If you have the ability, slow down and take your time. Keep the patient in place. Do not allow the patient to go into a room where you are unfamiliar, where they may look for weapons or other items to protect themselves. Now let's talk about the 3 R's which can help bring the patient back to a baseline for low stress and a feeling of security. Despite our best efforts, people with dementia will have moments of anxiety, confusion, anxiousness, or even a full stress response. Knowing someone's personal background information is what we will use to help bring them back up the pyramid to feelings of safety, security, and belonging. The technique is called repeat, reframe, redirect, or the 3 R's. This technique is easy to learn, but can bring a huge benefit. Repeat. During the repeat step, we want the person with dementia to feel validated in what they are experiencing. Start with a calm and friendly approach, repeating their words back to them. Remember, be a friend, not a boss. Empathize, don't argue. Reframe. Once you have acknowledged the reality of the person with dementia, you can move on to step 2, reframe. Bridge phrases are expressions that help to move conversations to a new place. Bridge phrase examples include, "That's a good question. Let's find out together." "I understand what you mean. Come with me to the hospital. We can find a solution." "That sounds scary. Let's put on some music to help you feel better. What's your favorite music?" The idea is to repeat where the person is now, then reframe the topic in a way that allows you to move to step 3. Redirect. Presenting something specific and different might be a change of scenery, a different activity, a chore you need help with, or a favorite snack. Anything that breaks the pattern of behavior. Use body language to guide the person. An arm around the shoulder, a hand stretched out in invitation. When we honor the world of the person with dementia, we unlock the puzzle to their behavior. Being a friend, not a boss, is key. Slow down and smile. Monitor your nonverbal communication. Therapeutic fibs, aka little white lies, are okay when they benefit the patient. Maintain emotional safety if a stress reaction is triggered. Repeat, reframe, and redirect.